Hello and welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hung, and today with me is Cedric Savarese, founder and CEO of FormAssembly. Cedric, welcome to the program.
Thank you for having me.
Cedric, before we dive too deep into our topic today, can you give our audience a quick outline of what FormAssembly is and what you do?
Yeah, absolutely. So FormAssembly is a data collection platform. It helps organizations collect data through online forms and surveys and really streamline their business processes in a way that's easy to use, secure, and compliant.
And you do a lot of work in healthcare, correct?
So yeah, we provide a platform that can be used for a lot of different use cases, but we work a lot in the healthcare space, and we invest a lot in compliance, including HIPAA compliance.
Now, collecting data is obviously very important in healthcare, as well as other industries, but it can be a very tedious process. And right now, given all of the issues with staffing and looking, everyone is looking for ways to do more with less. What are some of the advantages and why is streamlining healthcare processes so important right now in your mind?
Yeah, so I think if you think about the way people interact with their healthcare providers, it typically starts with at the office desk, where you fill out a few paper forms with your insurance information and your medical history, right? Right. And then someone has to manually enter it in a patient record systems afterward, right? So this in itself is already an opportunity to streamline the process, right? Many people nowadays, maybe not everyone, but many people are more than capable of filling this information electronically, right? So you can reduce the workload on the staff, and you can also reduce the risk of transcription errors, right, in the process. But really, that's really only the tip of the iceberg in terms of how healthcare organizations and life science organizations collect data. There are dozens of other use cases where organizations need really to secure a secure data collection platform.
And can you give me an example of some of these healthcare processes or data collection processes that you've helped clients improve?
Yeah, so a patient intake form is one example, but as I said, it's just one of many processes, and so anything from collecting feedback from patients after their experience with the organization, to, for instance, recruiting patients for clinical trials, right? And that's why organizations tend to a platform like ours, because a lot of those use cases tend to be very custom or very different from one another, right? So you need a platform that is very flexible, that puts the stakeholders in control of the data collection processes. So we have, for instance, pharmaceutical companies using our product to process online applications for some of their programs, for instance, a drug assistance program. And if you can imagine what it's like if you want to enroll in a drug assistance program, you probably have to share a lot of information about yourself, why you're eligible for this program, so whether it's your financial situation or your health conditions and so on. So it's a lot of sensitive information that is being processed that way. And the application itself is just the first step, right? There's a workflow behind it that allows the organization to review those applications and essentially improve them.
I want to circle back to the security in a second, but do want to just ask you this follow-up. You mentioned that no matter what tool someone implements, it has to be fairly flexible because the forms are not the same from one application to the next. I'm assuming that do you have some templates where people can start, or is it pretty much? And I'm assuming it's pretty easy for someone to create the forms that they want in your system. Yeah.
So our position is that the stakeholders, the professionals, know what sort of data they need to collect, right? They live with it day to day. It's part of their business processes. They know what they need, and rather than working with IT and spending time explaining what you need and this taking weeks or months to be done, we believe that we should empower those people to do it themselves, right? So so the software is designed to be very easy to use, not require any sort of technical skills. It's a no code or low code in some cases software. And so they can design their data collection process for whatever use case that they have. But from an IT perspective, that doesn't mean you have to, surrender that process entirely. It frees up some of your IT resources, but you keep oversight over what's happening, right? So, and you have a standardized way of doing things that's secure. So it improves your security postures, it improves your compliance risk. But at the same time, it really empowers people to do what they need to do.
Yeah, definitely low code and no code are very big things in healthcare because we in healthcare, we never have enough staff, right? Even in pre-COVID times, we never had enough IT staff to do all the work that was needed. So anything that can relieve the burden on IT, but also put the power in the hands of the users who know that stuff best is always a good thing. It's always a good thing. So let's go back to the security questions since you brought it up. I mean, obviously, a lot of the information that's collected in healthcare is pretty sensitive. You're asking patients for a lot of intimate details about their disease or about their situation they entered into these forms. Why is it so important to think about the security of forms and not just how the form is collected and the information and the fields on it? Like, what are some of the considerations that you recommend people think about when they're creating forms from a security perspective?
Yeah, so as you pointed out, unfortunately, the vast amount of personal data and health information that's being collected in the industry makes it, a prime target for attacks or even just security breaches that are just internal errors, right? For instance, so security is really not optional, right? It has to be built into your processes and into the tools that you use. If you're in IT, you're probably spending a lot of time thinking about your core mission critical processes, right? And you're spending a lot of time making sure that they're secure. And you may not have as much time to think about the more mundane use cases, right? And there might be a lot of ways in your organization where data is collected where you actually have no visibility over, right? Because it's, an employee somewhere is deciding to use a third-party product out there to just, for whatever reason they had, and that happens outside of the purview of IT, right? And so that's where you have some risk where you really can't control and you really don't know what's happening, right? So this idea of having a standardized platform that you can use across the board, not only for your mission critical data collection processes, but also for all the other tangential use cases, is very important, right? It allows you to, first of all, you have to train your staff on only one platform, whether you need to send out a survey or power your contact form or do some field data collection and for your trials. You can have one platform that can be used across the board, and that is secure. And then as an IT person or as a compliance officer, you can actually review that. You can see who's collecting data for what purpose and where is that data collected, right? So when you think about the information that you collect, that's the first thing. Make sure that you have a platform that gives you really good oversight, right? And then there's a lot of best practices when it comes to data collection. Making sure you only collect the information that you need. For instance, that's the first. That's an important. Data minimization is important, right? And so a data platform that connects to your systems is very useful, right? So because you don't need to ask for information that you already have, for instance, right? So that's another thing to keep in mind.
I like what you said there, because it made me think about something that I hadn't really thought of when I think about form products. One of the easiest ways to identify something that where your solutions could be applied, of course, is anything that's done on paper, right? If you're filling out a paper form, that's an obvious candidate to digitize. But I think at least in the last decade, healthcare has done a pretty good job at eliminating those. But you brought up something that I hadn't thought about, and that is all these other forms, electronic ones, that people just sort of spin up because it's like a single use, or, oh, I'll just do a quick and dirty one right here. Like, maybe I'll just use a WordPress form, right? Or maybe I'll just use this form that's in this tool that I'm using. But you brought up that, hey, like that form, although easy to implement, may not be secure. It doesn't maybe give you the oversight that a platform like yours can. And you even talked about something that's very critical, where you need to track where that data is going and who's accessing it, which a lot of these other form tools don't do, right?
Exactly. HIPAA compliance is not something that applies just to one aspect of your organization and your process, right? It applies to anything. Anybody in your organization that collects patient information for whatever reason falls under HIPAA. With the pandemic, we've seen a lot of organization had to adapt very quickly, right? Almost overnight, you had to shut down your office, or you had to switch to an electronic process because you don't want to do face-to-face interactions anymore, right? Non-essential procedures had to be postponed, and suddenly you had staff that didn't have anything to do anymore, nurses and doctors that were basically out of a job. And so being able to be flexible and reactive and agile is really important. We worked with, for instance, with the California Health Corps, which was set up by the state of California to really manage that COVID-19 crisis. And one of the things they needed to do is figure out a way to mobilize the resources that were suddenly freed up, those nurses and doctors that didn't have anything to do anymore, and redirect them toward where they actually were going to be helpful. And in order to do that, you need to start by asking people to volunteer and share information about where they, when they are available, what sort of skills they have, what they can contribute, and so on, right? So this is an example of a data collection process that suddenly became very, very critical overnight, and you had to be able to react quickly.
Cedric, if I was a CIO of a health system, or or for a manager at a healthcare facility, and was thinking about a form tool like yours or a platform like yours, what are some of the things you would say to me to convince me that this is a good idea?
Yeah, so I think we've all been part of IT projects that are very complicated and that might take months, if not years, to roll out, right? So I would say, maybe start simple. There's probably a lot of small processes like the one you mentioned, like where someone might be tempted to use a WordPress form or some, things that come out of the box with some services that the organization use, but are not designed to be HIPAA compliant, for instance, right? So maybe start with those small projects where you can actually lower your risk, lower your exposure by deploying a platform like ours, and start re-optimizing your data collection processes in that way. And then you can tackle the more important things where you start to integrate with your your patient health records and so on.
Thank you. That's fantastic. Cedric, where can people go to learn more about FormAssembly?
Well, you can go to formassembly.com. That would be the best way to get started. The product, you can try the product yourself if you want, or you can talk to our sales team. We'd be excited to have you try our product.
Cedric, thank you so much for taking the time out of your day today to talk with me. This is very fascinating, and you pointed out a couple of things I just never thought of when I think about online forms.
Awesome. Well, thanks, Colin, for having me.
Hey, if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening and watching this. Also, head on over to healthcareittoday.com to access free resources, industry news, and insightful articles. You can also connect with us on Twitter at the hashtag HITSM. I'm Colin Hung along with Cedric. Thanks for being here.
Thank you.